Good day, friends of Buzzy. I made myself a new mask so I can be a ninja, or I can be a little bit calm and friendly. That's a friendlier one. So a couple things today. I didn't really need the mask because I am here completely alone, and so therefore right now you're getting this backwards. I will turn this around when I have to so you can read things. So what we're going to do today is we're going to start off talking about COVID like we do, and then we will switch to talking a little bit about pain. We have a new pain care partner to tell you about, and then I'll have a little bit of information to help you deal with fear and a little bit to help you deal with focus. But for the first thing, I'm going to go ahead and switch this around so that you can see, so concepts for COVID. First thing is that the best information at this time is to take vitamin D and zinc when you're just trying to keep your immune system up. There are different things in different countries. Singapore is suggesting taking garlic. I don't have any good data or amounts for that, so I'm going to stick with vitamin D and zinc. I can tell you firsthand, oh my Lord, I can tell you firsthand, if you're going to take zinc, take it with food, because 25 milligrams of that is very hard on your stomach. And then you're going to think you've got nausea, and then you're going to be worried, and then you'll realize it's just the zinc. So just to keep yourself healthy, vitamin D and zinc. Stop taking the vitamin D if you do get sick, because with COVID, we don't want to enhance the immune system. So after you get sick, if you get sick, then go for a vitamin C. And studies show about 500 is all you really need before you get sick. If you get sick, you can go up to 3,000 milligrams a day. Vitamin C is nice because it's one of those things that you can just pee out, and so it doesn't accumulate. You can't really overdose on vitamin C. So that's cool. The other nice piece of news is that the NIH has put together a repository of treatments that are proven, and they have different levels of recommendations. So A, B, and C levels of recommendation based on the quality of research. So at this point, there's really nothing that's proven to work. The recommendations are against using hydroxychloroquine and azithromycin together. There is no recommendation yet on hydroxychloroquine alone, although I think you may have heard there's a new study that came out looking at patients in the VA, and patients were about twice as likely to die on hydroxychloroquine than not. So I wouldn't take that unless there's a doctor who is in the ICU prescribing it for you. But one thing that I thought was really good news, especially if you do get the mild illness, is that the NIH does not have any recommendations against either acetaminophen or ibuprofen. So if you don't feel good, go ahead and take whichever one you want. All of the early stuff about ibuprofen hasn't been substantiated, so I will keep checking the NIH treatment guideline list to see, but until we know more, at least, there's not a reason not to take ibuprofen. Now, the other thing, I am hopeful that my alma mater, so I've been doing this now. I've been doing this for 5 up-the-nose rinses, and I have determined that one nostril is a little easier than the other. I've also determined that once you have irrigated your nose, sometimes there's little pockets that you'll lean over to pick something up, and you'll discover, whoo, there it goes. So just be warned, you may want to have some sort of a cloth on you for the next hour or so after you do nasal irrigation. I also am very comfortable now that betadine is a fine thing to add, and so I am doing the betadine. I'm going to wait on the other people to do the surfactant study because I don't want to bubble out of my nose. And the really best part is that it sounds like my medical school in Georgia that I have a clinical appointment at, because I am an MD and a pediatric emergency doctor, and so this was from Dallas Children's. Go Dallas Children's! But my school in Augusta, Medical College of Georgia, will be doing the testing in Georgia. So we're talking to each other to see whether or not we can get a grant to go ahead and randomize people to doing nasal irrigation or not, to see if it changes the asymptomatic and the pre-symptomatic, to see if it changes the duration of illness and their symptoms. So hopefully, well, stay tuned. That'll be an interesting deviation from my normal pain studies, but it is something that will probably happen fast if it happens at all. All right, so you may have heard, if you're not in Georgia, that our governor decided to open up beauty parlors, tattoo parlors, some restaurants, and a few other businesses. There's several things ironic about this. The first one, of course, is that we don't have any of the criteria met for reducing distancing. Like, our cases are still going up. We are not testing. We're in the bottom 10 states of testing. So that's ridiculous. But the other thing that's ironic, and a purely personal note, is that I finally got tired of it, and I took trauma shears to my hair about 2 days ago, right before the announcement came out. Not that I would go to the hairdresser anyway, but I just want to tell you that, so it turns out, it's not terribly bad. And of course, the other thing is really, see, that's still a little bit long, but so let's see, it's the one good thing. Yeah, there you go. So trauma shears are perfectly acceptable. And the third irony about the fact that I took trauma shears to my hair is that this is not the first time. Many's the time in the middle of a string of emergency shifts where I would get to the place where I just couldn't stand it anymore. And so I have taken trauma shears to my hair multiple times. It is what it is. Someone will have to clean up the damage later. All right, so now I want to talk about our newest pain care partner. So as you know, with every Vibracool, this is the extended for the knee, so if you can't get your knee replacement or you're having knee pain, it's got the Vibracool vibration device inside, it's got 2 sets of ice packs, and it also comes with a lot of things from our partners. So we're including the What Works for Pain list that has 50 plus evidence-based mechanisms for dealing with pain, including physical solutions, supplements, and mind-body. And all sorts of fun stuff inside, including, while supplies last, we still have some disinfectant spray, and we've got some other pain samples. So we have, from our partner, we have something that takes care of 2 of these mind-body. One of them is to get rid of fear. We've got some lavender spray, which is comforting and smells fantastic. And from hotcoldcomfort.com. So this is a wonderful smelling, it's probably rice, and you put it in the microwave for 45 seconds. And so you've got not only the relaxation of the weightedness of it, but also the heat, and it can be put into a freezer. So we will have coupons for hotcoldcomfort.com on our website. And thank you, our pain partner, for providing us with warm and aromatherapy ways to deal with pain. All right. So for our focus section, many people are having a really frustrating time not having sports. So there are 2 different normally on-demand, now free sports URLs that we will be posting on our website. And if that is what does it for you, I think that probably watching sports may be more productive than taking trauma shears to your hair. So at this point, that's what we've got. We've got the fact that the NIH is putting together trials that hopefully will be able to test the irrigation trial, and I will certainly, I'm not endorsed at all by NeilMed. I just think that it's a good product. Hopefully we'll be able to get some data behind whether or not that does decrease duration or not. And next time I see you, I will see if we've got any new news on the NIH website looking at ways we can help with COVID. But for right now, you can know that the vitamin D is supported before, that zinc is supported before and during, and vitamin C is supported during. And the government right now in the US is telling their military to do vitamin C and zinc. So those two are really supported. All right, friends, I can tell you that we're getting closer. It's gonna be fine. Thank you for tuning in. Subscribe, like, I'm sure there's a way to do that. See you on Friday.